treatment for immune flares. Now, what is your lymphatic system? The best way I can think of that, well, the best way that I was taught to understand this was to think of a network of highways running together in a metropolitan area. Okay, so you have your lymph vessels and lymph capillaries. Think of that as the actual roads. Then you have lymph nodes. Nodes are like the toll booths. And lastly, the vehicles on the road is the lymph, the actual fluid in there. So when you're talking about your lymphatic system, it's also good to know that your lymphatic system only, that fluid only runs in one direction. It cannot backtrack. It actually has little stoppers from your lymph fluid from moving backward. Another thing to note on this is your lymph cannot move on its own accord. You know how like your blood in your circulatory system pumps itself? Well, your lymph does not do that. You actually have to move your body to get your lymph to move. Okay, so keep those things in mind as you work through this. Other things that I want you to keep in mind is that there's a lot of education out there on your lymphatic system. And it's not that I want to say that it's bad information, it's more of what is effective and what's ineffective. If you're wanting to work on your lymph system and you jump straight into rebounding or jump straight into lymphatic massage, you may actually be doing more harm than good, or it may just be rendered ineffective. The key to starting out with treating your lymphatic system is to start with the nodes. So again, we're on the highway. Your lymph is the cars, and it's driving along those highway roads, which are your vessels and capillaries, and the nodes are the toll booths. We now have a traffic jam, so to speak, at your lymph nodes. So if you're dealing with a traffic jam, where do you start? The front or the back? You want to start at the front. So keeping this in mind, so I'm going to run through a treatment that you can do on your lymph nodes. I do recommend that you do this treatment at least once a day. Consistency truly is key. Doing it twice a day would be even better. I'd say do this as tolerated. And if you're wondering, well, how do I know what I can tolerate? It's really through trial and error. We're going to get more into that as I talk. As I go through the lymph node treatment, I may add other little tidbits of information in there, so just keep that in mind. I will be moving the camera. I'll try to keep it as smooth as possible, but to actually show you how to do this treatment, it's a full body thing. So let's just dive right in, shall we? All right, so working your lymph nodes, your lymph, again, flows all in one direction and it flows to your heart. Heart is on the left side of your chest. You want all that lymph to flow into your heart because your heart's going to circulate it out to the other organs in your body so that it can be flushed and excreted out of your body. So when the lymph fluid flows to a node, what your lymph node is doing is it's scanning. It's scanning for toxins, viruses, all sorts of different stuff. And then white blood cells from your immune system are then triggered in response to what has been scanned. So if there's a viral infection, it's going to trigger the appropriate white blood cells from there versus a bacterial versus something that may just be hormones, lots of stuff there. Okay, so we're going to start on the left side of our body because that is the side of our heart. And we want to start at the very beginning of that traffic jam. The very beginning, I also will refer to as the floodgates. That is right above your collarbone, the subclavian area up here. You want to kind of pulsate it. See if I can get, so kind of push in. If you're wondering how much pressure to use, think of it like you're checking for the ripeness of an avocado, a plum, mango, whatever that fruit may be. And you want to apply very gentle pressure like you would with those fruits. You can also pat it. That may work. You can do both sides simultaneously. If you need to only do one side at a time, always start with your left and then move to your right. So we're starting right here. You may begin to feel some drainage going down, maybe in your throat, could even be further up. Once you've completed both sides on that, then you want to move up. So moving up, You have lymph nodes in all areas of like movable joints in your body. So your neck can move, your jaw, all of these areas in here, you're going to have lots of nodes. They come in clusters. So just if you're wondering like where exactly to put your hands, don't worry. You get in that general area, just cover the whole surface area, you're going to get the lymph nodes. If it is tender, that can happen, especially if you're in a current flare. If it's tender, just lighten up on your pressure. Just keep moving through it as light as you need to so that it's not too painful. In time, that pain will lessen. So we've started here, went to here. Now we want to get into our axillary, into our armpits. This is another little tidbit way. Lighting may not be best right now, but when you lift up your armpit, you actually want it to pit inward. This has nothing to do with body shape, size, anything like that. Our armpits should pit in. If they do not, then that is saying that you have some stagnant lymph there, and working on your lymphatic system is definitely needed. So you want to get kind of where that pit would be, and you just want to push inward. Now, you can rest your arm down too. It may look like you're pulling towards, really just pushing inward. And then you want to get both sides. And also right in here, so again, think about this joint, it's movable. You want to get right in there, and you also want to pump right in here. And then get both sides. I'm going to speed this up strictly for video recording purposes. Once we get into the shoulder area, and that's flowing good, it doesn't hurt to go back and backtrack, because again, as we move it, more of it may drain down and it get clogged all over again. So it doesn't hurt to go back. It's real quick. Okay, now I'm going to move the camera downward because I've got to go down on the body. The next place, highly mobile area, you can turn right around here. So find your belly button, and just underneath the breasts here, you put a hand in that area, the other one in there. Amount of space will depend upon your body's structure. And again, you can push in gently, doesn't need to go too hard. In this area, I like to pat. I don't know why, I like that. Once you've done that, we're now going to continue to move downward into the inguinals area. Now this, we're going to get a little personal here. Move this downward further. This is down in the area of the groin. Now, you have your pubic bone in here. You want to go outside of the pubic bone, actual genitalia. So when you get, I'm just going to put my leg up here, you have your upper thigh. And that's the area you want to be in, is that upper thigh all around throughout here. This can get very tender for a lot of people. You may find as you're doing this that you need to go to the bathroom, urinate, empty bowels. You may find the need for that because your lymphatic system does play a role in that. And you may also find that you may improve low back, sciatic, or low back, gluteal pain. Not a guarantee, but it can happen. All right, once you're done with that area, you then go to behind the knees. Let's see if I can get a good area. So with behind the knees, here's the bend of my knee, above and below. Again, you want to work both sides. Start with the left. I actually started with my right, but that's just for recording purposes, but you do want to start on the left or do them both at the same time. Again, you can slap. The last area on the lower extremities is your ankle. So over here, you have that protruding, that bone that sticks out there. You want to go just behind it, underneath it, kind of wrap all around in there. And again, do that pumping. Once you've completed with that, we're going to move back up to your breastbone, your sternum, right in here. Now, I like to make a fist in this one. You can push in. Again, you don't have to be super strong to do this, especially if you're dealing with different things, osteoporosis, things like that. Be gentle with yourself. I like to kind of do like a little knock, that vibration of that, or move real fast up and down. This shouldn't cause an excessive amount of pain. So if you have costochondritis, a lot of inflammation in the cartilage there, it may be more sensitive. So just do it to the point where you can tolerate. Now, sorry, I'm doing this and it's actually loosening up some of my stuff. So my throat's getting a little tickly. Now, once you've done that, now's when you want to go into doing things like rebounding, lymphatic massage. Keep in mind with the lymphatic massage or dry brushing, what have you, you want to start closest to your heart. So I know when I first started getting into this, I would have people like if I actually went to someone to do a lymphatic massage, they would start way down here or they would start my lower extremities. No, no, you don't want to do that. Start up here. So going to your face, your neck. I like to get my sinuses. If I'm sick, this can really help loosen up some sinus congestion, getting in there. Then I'm going to go and I'm going to move that lymph fluid. Now, it's hard to tell in a video, but I am going really soft. Like I'm barely touching my skin. It should be, if you're ticklish, it'll definitely be ticklish when you do this. That's what you're looking for. You don't want to apply really no pressure. Your lymphatic system is really superficial. It's just underneath there. So going through here, I'm going to go further down on my arm and I'm going to guide it all the way to my heart. You don't want to just do a little bit here and move on. You want to continue to guide it, no matter how far away from your heart you are. Continue to guide it all the way up. We're going to pretend that I did both sides, and then I go down and I bring this up. I'm going to go into my lower extremities. Again, I'm at my hip level. I'm bringing this all the way up to my heart. I'm not just stopping it. So you go all the way down your body and you do that. Again, doing this, starting out once a day is great. I started out doing it in the mornings just because I could do this. And then I knew I was going to be walking more. So that would keep my lymph flowing. At night, what I do is I would do this exact same thing. And then I would lay down with my feet up against the wall. My legs up against the wall, flat up. And I'd lay there for about 10, 15, 20 minutes just to keep that lymph, let gravity do the work, essentially. If you're dealing with things like lymphedema, you get pooling of what looks like swollen or fluid-filled ankles, things like this. Working your lymphatic system is going to be very helpful in this. So kidney problems, all of those things, it's going to be very helpful. But I want to set the expectation. Once you start working on this, it's not an overnight fix, especially if you're dealing with things like lymphedema or some of those more chronic type things. Daily treatment for long periods of time. And really, I struggle a lot with my lymphatic system due to extensive injury, chronic virus, things along those lines. So this is something that I've been working on for 3 years, mostly consistently. The past few months, I haven't been as consistent, I'll admit. But doing this every day and it'll make a difference. So again, my armpits, they used to stick out more. They still do a little bit, but not nearly as much as they used to. And this is 3 years worth of working on it. So it is a very slow thing. But the more that your body learns how to eliminate these toxins, the more that you move your body, this will help you. If you tend to move your body and get sick, it's because one of those reasons is your lymphatic system. So working your lymph nodes will, over time, help you from getting sick just because you went for a walk. All right, guys. So that's what we got for this time. Next week, I don't have my outline with me. I apologize. I'm either going to be talking about gut health and nervous system or movement and rest. Either way, those are the things you can expect to learn more about through the month of November. I'd love for you to comment below if you've been practicing on working your lymphatic system. I want to hear what your experience is. If you're new to all of this and you have questions, put that in the chat. Send a private message if you don't want it public. Just really would love to hear from you. All right, guys, this has been good, and I look forward to seeing you next Monday at 2:45 p.m. Mountain Daylight Time.